Here with Dr. Katie. Hi, Dr. Katie.
Hello.
Hey, we hate to bother you. We know you're working, but we have an ask.
Working very hard right now.
I see that. We have an Ask Dr. Katie question.
Very hard too.
We have an Ask Dr. Katie question for you.
Okie doke.
So, why dentals? I know this month we've had some specials going on for our clients for dentals. Why the emphasis on dentals?
Well, one of the things that we really emphasize here at VCF is preventive care. And this is my friend Tiger Lily. And Tiger Lily's kind of famous at VCF. She's actually supposed to be my son's service dog. But Tiger Lily actually flunked out of the Seeing Eye Dog program. And
that's at Southwestern Guide Dog Schools?
Yeah, Southeastern Guide Dog.
Southeastern, right.
And
so she's flunky. She's a flunky.
She's a flunky. She was at Dillard's with a blind person and kind of had a meltdown and curled up in a ball and decided it was too much work and stress in her life. So we ended up with her. And she's wonderful. She's a little fat, but, you know, so am I, so it's all good.
She's awesome with children.
Awesome with children, and just as sweet as they come. So obviously, since Tiger means so much to my son and to the rest of us at VCF, we want to make sure she stays healthy. And one of the ways that we do that is to give her annual dental cleanings. It's become fashionable not to really call them dentals. It's supposed to now be the comprehensive oral exam and prophy, but most of my clients, and I'm kind of an old fart, we all call it dentals. You know,
yeah, I don't have any of that done on my mouth. I go to the dentist for a dental cleaning.
Exactly.
Yeah, so that's we're talking about dentals.
That's right. We're talking about dental cleaning.
So, and why is that so important?
Well, it's important for a lot of reasons. One of them is, the most obvious, is Tiger can tell me a lot of things, and she's telling me right now she wants some more cookies out of my pocket, obviously. But she can't tell me a lot of the time if she's got an abscess in her mouth, or if she's got something going on in her mouth that's painful. And so one of the things about a dental cleaning is that it allows us to get in there and really look at her teeth. I know it's gotten a little bit of fashionable to try the sprays and maybe have your groomer scale some of the tartar, and the drawback to that is if there's an abscessed tooth in there or there's something going on below the gum line, without doing dental x-rays, without doing a good dental prophy check, you're not going to know that, and your pet may be quietly, silently suffering with something in their mouth that's kind of miserable. I've had a lot of dental work done too, and so I'm a little bit sensitive to having owies in my mouth, and believe me, your pet is too. So what we try to do here is make sure that their mouths are comfortable, there's nothing going on in there that could be a problem. The other thing is tartar and calculi and significant bacteria buildup in the mouth can lead to heart disease. It can lead to pancreatitis, kidney problems, because that bacteria.
Well, so it's not just the comfort of the pet; it's actually health issues.
It's a health issue.
I see.
We don't want a lot of bacteria hanging out in the bloodstream, and a lot of bacteria in the mouth can get right up in the bloodstream and cause problems with heart valves and other things. So, for overall health, it's important to keep our mouth bacteria-free and clean, or reduce the amount of bacteria.
Okay, and don't I remember seeing a pet too that actually had a tooth coming out the other side? I mean, literally coming out of its face.
Well, the tooth wasn't coming out of its face, but what happened was they had what we call a tooth root abscess, and some of them can get quite nasty. And yes, I've seen pets that have actually had pus coming from the side of their teeth.
I remember seeing that. It's horrible.
Because all the roots are connected up into this maxillary sinus. And so if there's an infection there, it'll go right up into the sinus, and it'll actually sometimes break out of the front of the dog's face. So
I see.
Pretty nasty.
Okay. So not just the comfort of the dog, but also for health reasons.
Significant health reasons.
And then does doing a dental also help with, sometimes dogs can have kind of funky breath?
Yes, it helps with the funkiness. We don't want funky breath. And
well, they're easier to love when they don't have the funkiness, that's for sure.
Most of them, I'm always in their face. My mom said I would get worms as a kid because I kissed dogs all the time, and you know, obviously I keep doing it. Yeah, I'm fine. So, but yeah, that's something that definitely, if we're going to be up close and personal with our furry friends, we probably want to make sure their mouths are clean.
I see. So when you do a dental, as far as the examination goes, how do you figure out if you need to have a dental cleaning?
It's pretty simple, but again, this is why you want to go to a veterinarian that's going to give your dog a comprehensive oral exam. You don't want someone just in a parking lot to give your dog a shot in the butt. You want them to actually look. I know I've got cookies for you, honey. They're right here. Look at your dog from nose to tail, and that includes the mouth. You need to actually get into that mouth. Of course, that's
let me see, right.
And then you're going to want Tiger.
Is this what you usually do, is to distract them with cookies?
Yes, I try to distract them with cookies, and sometimes it works really great, and other times not so swimmingly. But basically what we're looking for is I want to see if there's any bleeding. Are there any masses in the mouth that I need to worry about? She's got one little spot on her gum over this tooth. We call that
See
one.
if we can get her to
Tiger,
settle.
be good girl. And she's got a little bit of a bleeding spot there. So that's going to be an area I'm going to really want to watch. She actually has pretty good teeth because we do dental cleanings regularly. She doesn't have a lot of tartar buildup.
Yeah,
but what
she does. Yeah, they look pretty good.
They look pretty good. So what I do is I look in the
Not
mouth.
that I know anything, Dr. Katie.
Well,
but,
you know,
just from a glance, they don't look as nasty as some that I've seen.
A lot of this is common sense, folks. If it
Right.
looks nasty and it's bleeding, it's probably not good.
Right.
And you can do this at home. Lift your dog's lip up and see what's going on in there. If your inclination is the as soon as you look in there,
then it probably is.
Somebody needs to take a look,
right.
Especially if teeth fall out when you look in there. That's never a good sign either. The other thing that you want to do is make sure your veterinarian opens that mouth and looks down in there. Sometimes you can have masses.
That must get really exciting with certain dogs trying to do that.
They show me their teeth, without being requested.
Right.
So it makes it a little bit more convenient.
Okay. So that's basically an oral exam and the things necessary to figure out if you need a dental, and then if you do, don't delay because obviously there's some significant health issues.
There's a lot of things that can go on in a dog's mouth. Dogs are incredibly they're very good at hiding pain. The way that the wild works is if you're the animal out there limping, you're lunch. So dogs will do anything they can not to whine and not to whimper. Sometimes all a dog will do to show pain is panting. So we can't just assume because they're not whining that there's not something going on that's uncomfortable. So, take a look in there, lift the lip up, see what's going on in there, and if it looks kind of icky, it might be, and get your veterinarian to take a good
So bottom line is an ounce of prevention here, right?
Prevention.
Okay.
Yeah, if we do cleanings before we get abscesses, we can save teeth, and we can make their lives a whole lot better quality.
Super. Thank you, Dr. Katie.
Thank you very much. Thanks, Tiger. Good girl.